Welcome to SVG-TV News for Tuesday, April 28, 2015. I am Jennifer Richardson with the details. A total of 6 houses, in addition to a number of offer of letters for the ownership of lands, were yesterday handed over to residents of Caratal, Georgetown. Yesterday's handing over ceremony at Caratal brought the number of communities to have benefited within the past week from similar donations from the government of SVG to 3. The other 2 communities are Carapan and Connery. All 6 recipients of the houses in Caratal were displaced following the trough system, which battered SVG in December of 2013. Director of the National Emergency Management Organization, NEMO, Howie Prince, says the government of SVG continues to take steps to ensure that the country is on a firm footing as it relates to disaster management. Prince says there are broadly 4 areas that any government has to look at if it is to boast about its programs for the management of disasters within the country. The NEMO director explains that the first of those areas is the government's ability to provide the right information, knowledge and understanding of hazards that are likely to affect the country.
What can hit us, how hard they can hit us, when they're likely to hit us, and we need to know what we should do when any one of these things, whether from outside of the country or internally, impact us, resulting in the kind of displacement we have seen. The second very important thing that all good governments must do in the area of disaster management is to be able to put systems in place so that their people can be prepared for disasters, so that there can be early warning system to tell you what is going to happen before they happen, and systems in place to respond. The third very important aspect of a government being able to respond well to people's needs in disaster management is for the government to have a political will to be able to be sure that there are recovery programs in place. Today, as I stand on these grounds, I tell you there is the demonstration that this government has more than it takes as far as the political will is necessary to respond and to be sure that recovery programs are in place. Finally, we have boasted that when we do things as far as the recovery process is concerned, we're building back better.
Chairman of the Housing and Lands Development Corporation, Sir Vincent Beach, says there are a lot of firsts that can be attached to the name of SVG, including being the first and only country to pay student nurses to obtain a profession and building homes for citizens free of cost following disasters.
We are people-centered, this administration. Howie Prince told you that government, but it is not government, it's administration. We've had administration before where you had disasters, they come and they look at it. If the road is bad, they would fix the road. If you have a slide and they have to build a back wall, they will do that, but you have to fend for yourselves. We have, because of these disasters, and under the astute leadership of Montgomery Daniel, Minister of Housing, we have built and handed over in excess of 150 houses free to persons who are affected by these disasters.
Meanwhile, Prime Minister Dr. Rav Gonsalves says the Caratal project carries a price tag of over $1 million and explains that the lands have an estimated cost of $600,000.
In relation to the houses, we have here 2 one-bedroom houses and 4 two-bedroom houses. And each of these houses is far better accommodation than the persons who lost their houses in the storm. And these houses are the gift of the people of St. Vincent and the Grenadines acting through their government.
In the month of May, the government is scheduled to distribute more homes and lands to needy Vincentians on the leeward side of mainland St. Vincent. And Minister of Housing and Parliamentary Representative for the North Windward constituency, Montgomery Daniel, used yesterday's handing over ceremony to respond to a newspaper article dated Friday, April 17, 2015, captioned, "Call made to honor the Garifuna people." Daniel says the issues raised in the article were all of concern to him prior to 2001, except the call for a monument to be erected in Greggs and at Baliso.
I have nothing against the people of Greggs because they too are of Garifuna descendants according to our history. But if you are identifying a monument for Greggs and for Baliso, why not Sandy Bay? Because Sandy Bay is the largest Garifuna community in St. Vincent and the Grenadines. I also went on further to think whether or not in building a monument in Greggs or in Baliso, whether or not these monuments will not be defaced, or whether or not these monuments will not be stolen. Every year, we will meet at the obelisk in Dorsetshire Hill to honor the Garifuna people of this country. But even the flowers, the wreaths that we place in the honor of our foreparents, they have been stolen. What guarantee do we have that these monuments will not be stolen?
Minister Daniel says it is time that persons recognize that the Garifuna people of SVG must have dignity and pride in the country.
No more should there be any theft of any wreaths or otherwise for our foreparents of this country. I want for the youths of this country, I want to chronicle over a period of time what I think is important for the youths to know of what this government has done for the Garifuna people of this country. Because I said to you, no other government that has come to govern this country has done enough like this present administration.
Yesterday saw the launch and placement of the steel beams for the Hope Bridge in Vermont. The Ministry of Transport and Works, Urban Development and Local Government says the construction work on the Hope Bridge rehabilitation project is progressing apace. The work on the bridge is being carried out by the Ecuadorian Army Corps. Yesterday's event was witnessed by members of the general public and the local media. In an interview with SVGTV News, Chief Engineer in the Ministry of Transport and Works, Brent Bailey, says the launching of the bridge is quite significant and also took the time to explain what exactly the day's activity entailed.
What we are seeing here is effectively a very delicate balance in getting the four steel beams across the, well, effectively spanning the, effectively to span the river itself. The critical thing we have to control in this launching is, one, ensuring that the beams themselves do not shift too far off horizontal alignment, and to guide that we have those four lines, well, effectively they're strings, but they effectively to ensure that the beams can fit into the designated slots on each side of the abutment. In the middle of the river there is a stanchion that is effectively to support the beams as they get to mid-span. The intention is to, one, ensure that the horizontal alignment of the beams are not off course, and it is also to support the beams themselves as they cross mid-span.
Bailey adds that though the project is progressing smoothly, having to work with limited resources, specifically limited heavy equipment, has posed some challenges.
The construction methodology is painstaking because we have a limited amount of equipment. At present, they're utilizing an excavator and a bulldozer. this is not ideal, but that's the equipment we have on site. You have to bear in mind that a lot of the excavators that are on the island are occupied at present doing a lot of the, the various construction projects that are going on through St. Vincent. So when you have this level of construction activity going on, there naturally becomes a limited in your equipment resources, your manpower, etc.
In highlighting a number of the projects currently being undertaken in the South Leeward constituency, Bailey says he is also at the moment putting plans in place for the rebuilding of the Camden Park Community Centre.
That project, we are looking at demolishing the existing structure and constructing a totally a new community center that can accommodate the community in the case that there is a disaster where we have to relocate people into emergency shelters. I am also looking at doing some renovations to the Pembroke Community Center as well, to basically do some upgrades to that facility to be used as a storm shelter. So there are various activities that are planned for this community to basically improve our resources or resilience to the impacts of flooding and other natural disasters.
Minister of Health and Wellness Clayton Bergen is encouraging employers to ensure that the work environment is safe for workers. The appeal comes as the country joins the rest of the world in celebrating the International Labour Organization ILO World Health Day for Safety and Health today, April 28th. Under the theme Join in Building a Culture of Prevention on Occupational Safety and Health, Minister Bergen says having a safe working environment will not only limit loss of life and business, but would also improve credibility within the eyes of clientele.
Attention to health and safety is not just about being socially responsible. It also makes good business sense, and it should be considered as important as the achievement of any other key business objective. Regardless of the size or nature of the business, the underlying aim of good health and safety management is to ensure that people's safety is not put at risk and that their health is not compromised or damaged. In essence, it is important to ensure the absence of risks to safety and health of employees and others, so far as is reasonably possible.
The Health and Wellness Minister says this country will continue to adhere to the regulations of the ILO, which he says ensures that there are standards such as equity, security, and human dignity.
It aims to promote rights at work, encourage decent employment, boost social protection, and strengthen dialogue in work-related issues. Why then health and safety at the workplace? It is safe to say that whatever the nature of the business, there's always the possibility of an accident or damage to someone's health. All work exposes people to hazards, whether it is the manual loading of items, dangerous machinery, toxic substances, electricity, or even psychological hazards such as stress.
Under the theme Doing the Right Thing for Women's Health, the Pharmacy Council of St. Vincent and the Grenadines hosted a seminar on Saturday evening discussing some of the medical issues facing women. Under the sub-theme of emergency contraceptive, the Pharmacy Council highlighted the pros and cons of their usage while giving practitioners refresher information. Member of the Council, Stephen Millington, says emergency contraception such as the morning after pill has been around for about 40 years and expressed concern over the correct usage of the product. He says that women should be particularly aware of the risk since it can be fatal.
The answers to these questions and many others will help determine which distribution systems we can use to help women avoid unwanted pregnancy and also the proper use of this method. So in conclusion, over the last 40 years, we had the experience of the emergency contraceptive pills. While there is need for additional research, the available literature sustains a compelling case for expanding emergency contraception. Emergency contraceptives are simple to use, relatively inexpensive, and in many cases already accessible to women who need them. The remaining obstacles to their use may well be ignorance and safety consideration. And as providers, we need to educate ourselves and the women in which we come in contact with.
Delivering the feature address under the topic of basic pharmacology or prostaglandins with a focus on gynecological use was Professor of Pharmacology at the Trinity School of Medicine, Dr. Andreas Raymond. Dr. Raymond explained that prostaglandins medications, which are mainly used to help pregnant women dilate during delivery, must never just be used without investigating the health conditions of the patient, since there could be severe complications.
The patient should be basically healthy elsewhere. If there is an active cardiac condition, a pulmonary condition, including asthma, by the way, which is quite frequent here and prevalent in the Caribbean, hepatic and renal conditions, prostaglandins may aggravate those conditions. They can exacerbate inflammatory bowel disease. That's something extremely rare, or relatively rare, but the outcome is always fatal. If it's overlooked, that diagnosis, you have somebody with bloody stools, overlook that, that should be taken into account.
Dr. Raymond also cautioned that if a patient received prostaglandins medication and there is no delivery of the child, the fetus could also suffer severe complications.
Correlated with or associated with severe risk, uncomfortable, and dangerous side effects. That must be said. And if the dose is not high enough and you're not successful in doing that, then you must resort to surgical methods, because it has been shown that those fetuses that survive this procedure always have malformations after that.
Some 123 school feeding program workers earlier today received certificates for participating in a workshop that was held last year, aimed at improving the quality of nutrition in the meals for students. The workshop also focused on preparation and menu planning. Speaking at the graduation ceremony, Chief Education Officer Luan Gilchrist says that the Ministry of Education recognizes that health and education goes hand in hand and is therefore grateful for the support of the Ministry of Health on the project.
Education and the Ministry of Health, Wellness and the Environment embarked on the school nutrition training project in July last year, and we look forward to continued partnership as we work together to build a healthy nation. The purpose of the school nutrition training project workshop was to provide training mainly for our kitchen attendants on the school feeding program and other food service staff that provide meals to children. This is to ensure that the required standards are maintained so that the school feeding program and the other meal programs will continue to develop and grow. I am therefore happy that the participants in this workshop have undergone and successfully completed the required training, and that they are now better equipped to carry out the duties assigned to them with regard to preparing healthy, nutritious, and delicious meals in a hygienically sound environment. It is the policy of the government of St. Vincent and the Grenadines that every child in need is fed, and not only fed, but properly fed.
Gilchrist further notes that most persons do not recognize the need for students to have proper nutrition and how the lack of this can negatively impact their studies.
The school feeding program serves a broader purpose than just alleviating children's hunger. There is a strong correlation between proper nutrition, health and learning, and child development. This program, therefore, is designed to provide educational and health benefits for our children. Studies have shown that good nutrition contributes to good health and healthy living, and the converse, that poor nutrition produces ill health and retards physical, mental, and emotional development. When our children do not get the right nutrients in their diets, their health is negatively affected. They easily succumb to diseases caused by deficiencies in the diet. Sickly children, as you know, cannot participate meaningfully in their educational processes or in school activities such as sports.
And Administrator of the Mustique Charitable Trust, Lavinia Gunn, says since the establishment of the foundation, the sole purpose has been to provide aid to vulnerable children and young adults, which is why the trust is happy to support the project.
Because of inadequate nutrition or lack of nutrition, students were dropping out of school or not achieving their potential. Some of them would not come back in the afternoon because, quite frankly, they were hungry, despite the excellent school meal program run in the primary schools. It just wasn't filling the belly. So it was very interesting to us when Miss Andrea Robin contacted me and we started to talk about this program. So you're going to have some challenges. Don't give up. You've been through the training. You know what these children should be eating, and you're going to have to persuade them that this is the way we want our young people to eat. We've seen a lot in our local newspapers about the linkages between obesity and diabetes and hypertension. Similarly, undernourished children have their own specific needs.
As part of International Earth Day, which is celebrated every year on April 22nd, the Richmond Vale Academy held an exhibition at their institution at Chateaubriand on Saturday, the 23rd April. Sharon Garway tells us more about the day's event in this report.
Under the theme, It's Our Time to Lead, the 45th Earth Day celebrations was held in Chateaubriand on the leeward side of mainland St. Vincent by the Richmond Vale Academy. The Academy teamed up with the Organization of Eastern Caribbean States, OECS, the Ministry of Health, Wellness, and the Environment to showcase the best of local organic products in the country. From youngsters to the elderly, persons were told of the benefits of utilizing more natural products.
As it says, cold pressed coconut oil. Of course, this is naturally made. No heat whatsoever has been used, like a natural sunscreen. Because, I mean, if you put it on your skin and you walk in the sun, it tends to prevent you from getting sunburn. And as we say, darkening of the skin. Other thing you could use it for bracking. Bracking is where you put it in your mouth and all the mornings to help kill the bacteria in your mouth, yes.
When you use sugar, your body have to break that down. With honey now, it goes right through the bloodstream.
Our local tea bags, 100% organic. Well, you know, Guinea pepper is a local tea bag for our local bush from a long time that breaks gas. Moringa, the tree of life. We have sour sap, heal cancer cell. We have our Vinci hot ginger, break proper gas in the morning.
Local beauty products were also on display.
And I make organic soaps, deodorants, lip balms and lotions right here in St. Vincent and the Grenadines.
Plant life utilized for medicinal purposes was also illustrated.
So basically, people need to clean their systems. And one of the things that I stress strongly is if you do colon and blood cleansing every 3 months.
Director of Richmond Vale Academy, Stina Herberg, says not only is going organic helpful to the environment, but it's also beneficial to the economy.
So instead of that, we need to buy imported vitamin pills. We could grow a tree in a garden. We could use the leaves for tea. We could make some callaloo from it, or even make it into powder. And some could even make a little small business and sell it, make some more dollars. It's just a really healthy product, along with many other healthy products that we have in St. Vincent.
Sharon Garraway, SVG Television News.